Patient is a 16-year-old female of Greek descent. She is about to undergo bariatric surgery for weight loss. She has no known allergies. Diagnosis is adolescent morbid obesity, hypertriglyceridemia, diabetes type 2, obstructive sleep apnea, acne, hypertension, fatty liver, and PCOS. Patient has a BMI of 50.4, classifying her as morbidly obese. She has a history of overeating, primarily in the evening hours. Her blood pressure is 144/89, which lists her as hypertensive. Ideal body weight is about 135 pounds, and she currently is 312 pounds. She does have a history of irregular periods. Previous attempts to lose weight in the past year have been unsuccessful. She actually ended up gaining about 45 pounds within the last year. She is very motivated to lose weight because she wants to get new clothing. She wants to fit in with her peers and just feel better about herself and avoid being teased. Laboratory values that are abnormal. BUN is high. Her creatinine is high and sodium is high. Her parents are divorced, and she spends her time in between her mom and her dad's house. At her mom's house, she spends most of her time alone, prepares her own nutrient-dense foods, packaged foods like macaroni and cheese and chicken tenders, French fries, high-calorie snacks and cookies. At her father's house, she spends her time with her grandmother. In Greek culture is her yaya. What they spend a lot of time doing is preparing meals, Greek dishes for her father and her cousins. And she is reporting little to no physical activity. And then both parents are obese as well. A nutrition diagnosis is overweight/obesity related to disordered eating patterns as evidenced by a BMI of 50.4, self-reporting overconsumption of large portions of food, little to no physical activity, and an inability to lose a weight despite previous interventions. And she does have metabolic syndrome at this point. Nutrition intervention would be coordination of nutrition care with a psychologist pre and post-op. Also coordination of care with the weight loss surgeons pre and post-op. And nutrition education regarding bariatric surgery and post-operative nutrition and physical exercise requirements with the registered dietitian. I do have here an infographic here that just kind of shows the types of food that the patient will be allowed to eat. For instance, full liquids for the first week, and then advancing to puree for the next 2 to 4 weeks, followed by soft foods for the next 5 to 8 weeks, and then a regular texture diet after week 9. And then the goals are for the client to comply with the liquid diet for the first week, then advance to pureed foods, followed by soft foods and regular foods. Another goal would be to increase physical activity from no activity at all to at least a minimum of 30 minutes per day for the next 3 months. And elements of cultural competence that could be addressed in this situation are understanding the patient's culture and cultural norms, such as the tendency to eat late meals. That is something that is kind of a tradition in Greek culture, is they eat their dinners very late. Even though The Greek culture does follow the Mediterranean diet. Overconsumption of foods can also lead to obesity. And then as far as nutrition monitoring, we would be monitoring the height, weight, and BMI upon the next visit. Monitor the physical activity type, intensity, and duration. And then monitor a 24-hour food recall upon next visit.